I need to, I don't know who the next group is that's gonna be working with, on Tuesday and Thursday morning with the patients, but I need to fill this Thursday because we had an extra week. So if anyone could come in, I would appreciate it. So if the other group wants to come in, who's the next group? Who's supposed to work next week with them?
Right here.
Okay. Do you want to come in on Thursday and start early and have an extra day? Would y'all like to do that?
I'll have to see if somebody, I take my girls to school and stuff in the morning on Thursday.
Okay. Anybody else, would someone like to come and do that?
What time?
It's 8 and 9 o'clock on Thursday
So
morning.
it'd be like 10.
You're through at 10-ish, yeah.
We have class at afternoon. Be like,
I'll text my boss and see if I can.
Okay. Okay, I'll treat them. That's
I'll
okay.
see, I'll try to.
I mean, if y'all can, I'm just, it's been probably one of the most exciting patients that I've ever brought in, I'm gonna tell you.
I'll
I
be
mean,
here.
it's because every week we're seeing improvement, it's blowing me away, so it's just been really neat, to see both of them improve so much. So if you can, it's fine, I know it's coming up early and giving you a whole half a day off.
Me
so-
and Amy can be here.
Just if you can, it's fine. There are a few reflexes that I need you to look
Yeah,
up and
like-
know about that are gonna be on the test.
There's what?
A few reflexes that are gonna be on the test.
Hang on. Hold the thoughts.
In addition to our reflexes that we have.
Yeah, I don't think, is Gallant on there?
Yeah.
Oh, okay, it's on there, never mind. What about the tonic labyrinthian reflex?
Yes.
Yeah.
Okay, well, and the Moro reflex?
Yes.
Okay, well, all of them have a question about them. I just wanna make sure those are on there.
It's on that primitive input reflex sheet you gave us.
Okay, that's
I
fine.
got a question on those reflexes.
Uh-huh.
It's easy to remember what they are, easier. It's hard to remember the weeks, months that come in.
And when they come in, starting out.
And they're gonna be strong on the test.
There's probably 3 or 4 questions about it, and more so, there's not a lot during gestation. Most of it is things that happen after they're born. So
Okay.
if you want to concentrate, and it's when they resolve, not when they start so much, because we know they're gonna be at birth, so there won't be anything, I don't even think about preemies on there, so, that won't be on there, but just know when they resolve. And what's the word I'm looking for?
Kind of when they end?
Resolve. They integrate into the system and are no longer reflexes, it's integration.
Okay.
Okay, on the,
I still think I have the Gallant. You rub me there a little bit, I'll do that.
on the developmental milestones, when it says unilateral head lifting, does that just mean like a little bending? Or what?
Unilateral head lift,
It went from unilateral to bilateral.
yeah, it's to one side.
Okay. Could it be rotation too, or just a?
In 0 to 3
They're
months.
more just moving side to side, it's not just good bilateral stuff.
Okay.
Any other questions on it? There's about 10 questions on prosthetic orthotics. You need to know all those words of the shoes and all that kind of stuff and what they're needed for. You need to kind of look at that on the orthotics. The back braces that we went over, different names. Notice that, the little boy had a Boston back brace, correct, for scoliosis? But what's the name of the one that normally goes to scoliosis? Milwaukee really is the one you're gonna hear. That, is the one that the girls had to wear that had the pin in it, but of course they don't even do that anymore, but there was a question on it, on the licensure exam here about 2 or 3 years ago, but you may not have one, I don't know. But just so you know.
Is everything out of the PowerPoint on the orthotics,
Yes, it's all the orthotic and prosthetic information are on the PowerPoint notes that you have on prosthetics and orthotics.
Okay, but then it says something that says on page blah blah in this book.
Then you better look in the book, that's in the notes. Well, that's your different amputee levels, and that's probably the only one that sticks out in the amputee levels that's different is the signs, and that's where it's,
That's at the ankle, isn't it?
it's at the ankle, yeah. Otherwise, they're pretty, pretty, mid, tibia, and that, the different, the way they're divided in upper
So there are gonna be some
above
of
me and
those
below
questions?
me. Pardon?
So there are gonna be some of those questions, like the amputee questions?
No,
Okay.
but he just asked me that.
Oh, okay, okay.
Oh, so that,
So there's no amputee questions on the
It's pretty much just for prosthetic orthotics. And everything else is free game, right? It's just not amputee. I don't have any
That's why we
amputee
keep asking about
questions.
the amputee stuff, because it's free game.
Yeah,
You say
until
no,
table
but then you say
fees,
everything's free game.
and then the prosthetic and
On
orthotics.
the tilt table, I still have 90. Some people had it marked off and had 85. Did you change that?
What are you talking about?
On the
Like
degrees, if you
20,
raise it
40,
up.
75, 90? Some have the degrees at 85.
I changed it, like if they start having trouble, you're not gonna go up 20 each time.
Right.
Maybe that's what the change was.
Well, I
Okay.
think I think when you said it in lab, you said that 90 degrees, they feel like they're falling
Oh,
forward.
yeah, so you're gonna wanna bring them back,
Yeah,
yeah.
lean them back just a little bit.
It's not a real specific, you just don't
Okay.
want them to feel like they're falling on their face.
Okay. And then I had in my notes that spinal cord injuries would be more likely every 5 degrees you would lift it,
Mhm.
not every
Right,
20.
because they drop pretty quick and you just have to kind of watch them. One of the things we didn't go over, but we're gonna go over, after the test that you probably, is some different things you can use on a tilt table if people are having trouble with hypotension and things like that, or you can use, TED hose, cause that helps give them support in their legs, so you can do that with any type of patient, but for sure your spinal cord injury. But also, another thing that's very effective is an abdominal binder. Why would that be the case?
Supports their trunk.
Yeah, it just supports their trunk area, it keeps the diaphragm up, the lungs up in good position, it kind of just supports them in. So abdominal binders are other things you can use to help do that on a tilt table, and are especially used with spinal cord injuries.
What kind of hose?
Just
Yeah.
TED hose or, pressure hose.
Are we gonna have any wheelchair stuff on the test?
Uh,
Because we had that one, and we had it,
I don't think there's any wheelchair stuff.
like the home,
Yeah, I don't think it's in there. We've kind of covered that pretty
I
good.
thought that test was tomorrow.
No,
That's
it's
not
Thursday.
Okay, any other questions on the test? To do, like if they're having blood pressure problems or autonomic nervous system issues, they'll bring them up and see if they respond normally. So sometimes what happens is they'll come up and they'll drop and they will go up. Where if they're, someone that's not like a spinal cord injury, that's kind of the way they do. But they should, just like you did on the normal, go up to those different degrees and initially drops and goes back up. Or maybe it goes kind of high. So that's kind of that, where they just are doing the test to see.
Tara, when you can always ask your first question, you haven't asked it yet. I've been
There's
waiting.
50 questions.
Okay.
Ask yesterday.
Okay.
You don't want to do that.
That's how it's easy, it's just,
I mean,
you can be over the whole book, it's just,
Even if it's not across a pressure point or trigger point or whatever.
Now I wrote
as long as
that
it's not
stuff.
close to it, there's no pressure.
Well, not all of them are that tender, and a lot of them are tender in different spots. Those people who are so tender for anybody to touch them, or so, those are just real special cases. You just have to do the best you can, but, add it, it's kind of what you have to do. But, I would say that's a real severe case. Those are the ones that are bad, really got lots of problems. Those people- Okay, we are starting quadriplegia. I stuck the, spinal cord, PowerPoint from Neuro on the different spinal cord levels and everything in here. It's underneath stuff in this part under rehab, if you wanna review that again. And I would just tell you to pull all that spinal cord level stuff out, and we will test a week from today on that, just a quiz, so that I can tell that you've at least looked at it. It's not a real tough thing, but it's stuff you've had a number of times. What happens at the C6 level? What muscles come into the C5 level? Can the C5 quad be able to do this?
Okay, next Tuesday,
Oh, we-
test over spinal cord level.
Yeah, a quiz, not a
Quiz.
test, it's a quiz. So don't mess with it until after,
Next Monday's off.
Thursday, but we need to at least look at them.
I do that
On the 17th.
Well, I put it in here, then.
Is it just gonna be spinal cord, like injury?
That's why she remembers it more.
You'll be there with
You get
them.
it twice.
Anything's free game on from neuro.
So not just spinal cord, but
Trying to prepare for licensure exams.
That's why I told my wife I got married. Everything's free game.
You can get all that free game goes out the window as soon as you get married.
What day is the quiz now?
What we want to talk about today is get back into how you handle spinal cord injuries, and pretty much we're going to talk about quadriplegics, but this also applies to a paraplegic, especially if they're a high-level para and they're having a lot of respiratory issues. So we'll just look at, I guess I better get this back up there. Some of the different things that you do. You teach them a lot of deep breathing exercises, and that would be true for your paras and your quads, because as paras go up, remember they lose at the thoracic levels, they lose that level of their lung muscle. They lose the intercostals between those ribs at that level. So a high level, let's say a T8 paraplegic, they're pretty good with the respiratory, but they're still missing some of those intercostals. So you're gonna teach them, most of your quads are gonna be diaphragmatic breathing anyway. They're already doing that. So you don't have to teach them that, but you can at least watch and see if they do that. Some of the things you do is some manual contact stuff in different areas to increase their respiration. So you just put your hands on them and have them resist you, or put your hands over their thorax and have them breathe into you. Your goal is to expand their lung capacity. Because again, what happens to them is they get very limited. Remember that if they're up in the C6, 5 and 6 level, they're only at about 60% of what their lung capacity is. So you want to keep them breathing as deeply as possible, and so that's why you're doing breathing exercises.
Spread over thorax during expiration or inspiration?
You're gonna do both. You're gonna just hold your hand there. Another thing that you can do is put a weight on their diaphragm area right underneath their ribs and have them breathe with that on there. So these are just some different things you can do to do breathing exercises. But you're just gonna put your hands around their ribs and have them expand into them and
How heavy of a weight
resist
would
them.
you use for that?
I'd probably do 5 pounds. It kind of depends on the patient. Some of them are very limited and you're not gonna do that much. So it just depends on the strength, how strong they are. Almost all of this stuff, by the way, came out of your neuro book. It's in your spinal cord stuff, so it's all in there. It wouldn't hurt to read through those spinal cord chapters in your free time.
Wow, you are hilarious.
Okay, the next thing there is glossopharyngeal breathing, and basically they're sipping air. They're expanding their lungs, and this is not a bad thing to teach with a COPD not a COPD because we want them to get their stuff out. But if you have restrictive lung disease, maybe from cancer or something like that, you want to just sip it in, and so you just have them sip in a little more at a time, and just take as deep a breath as they can, but it's in little sips.
So they sip in, but they don't exhale.
Yeah, they don't exhale, they just suck in as much as they can, and again, your goal is to teach them to expand their lungs as much as you can. And the way you see that, even as you get them up and start exercising them and start working their trunk area, they'll get, like if you put them on the tilt table and did some of that stuff that we did with them, they might go from like 1,200 cc's to 2,500 cc's in a treatment. That is significant, that's gonna keep them alive. Because what kills a quad? A cold, because they don't have any breathing ability. Cold. What kills quads are urinary tract infections and respiratory stuff.
So you want them to sip in until they're full, and
Right. And then
exhale
exhale, and exhale probably through their mouth, just like, because you want them to exhale completely, but I don't think that's a problem with them. But you do want them just to really learn how to expand their lungs.
So do UTIs kill them because they don't know they have them and they end up being septic, or?
No, they do with UTIs almost all the time because they've got some kind of catheter going with them all the time. So
Do they-
they don't have down bladder control.
Why does it kill them?
Because it just becomes an issue because they've had them for so long, they have to go on stronger and stronger antibiotics. And normally, it only kills them if they don't take care of it. And a lot of your, if you don't have good care and you let a UTI go, you could die from it. And that's what happens with them.
It seems like if they's on antibiotics all the time, they get immune to antibiotics.
They do, that's part of what happens, so you just have to, it's just a real common thing for them to have UTIs. A lot of them go to a pubic catheter, so that the catheter goes directly into their bladder and it goes through a hole in their stomach. And that's because then they don't have to, the healthiest thing for them to do is cath for every 4 to 6 hours. That is the healthiest thing for them to do.
Really?
Even though you're dealing with all that bacteria going in there. An indwelling catheter is always more of an issue for infection. And so, but think what that does to their life. So that's somewhere they have to find a place to cath every 4 to 6 hours. And if they're, if they're in pretty good, not high level, they can do it sitting on sitting on a toilet even. But they just have to learn how to do it. Cathing is not fun. I don't know if y'all ever done it before, but it's just.
I think I would rather die than have one of those.
It's not that bad. You don't want to die. But anyway,
What about when they have,
Good enough.
Well, we're learning with Kendall's quality of life sometimes, She just laughed, yeah. Paul.
well, that's because I can't think he would tell you how to kill somebody.
No, he
Maybe.
didn't. We're just starting to consider quality of life.
Yeah.
yeah, none.
Well, you know what? You're going to be dealing with people, and you're going to have a different view, and you have to kind of keep your view quiet because, for me, I had an amputee patient that died about 2 weeks ago, and she had therapy the day before she died, and she was walking. And my prayer for my patients is always that they be on their feet the day they die. And so to me, she was only going downhill, she was really having some issues, and it was a real blessing in my eyes. But that's hard on the family, so you don't want to share that with a family member, right? And she was a wonderful person. And
Did you get her shoes?
Tons of family that loves her. Oh my goodness.
She's like, not yet.
I probably won't do that. But anyway, I'm gonna find out where I got that shoe.
It had somebody's name on it, I think.
Yeah, I think Andy brought those to me from a nursing home. Okay. The air shift maneuver I've never had very good luck with, but it's basically having them take a deep breath and then trying to kind of visually move their air from one side to the other. And I just have never had a good.
How do you explain to them how
Well,
to do that?
you tell them, okay, like you could put your hand on their chest and say, okay, try and move all the air over to that lung area and then down here. And I don't know, I've never had good luck with it. To me, I'm not a very good one for visualization stuff. I never have fit right into that. Although, they use it a lot in athletics to visualize what you're doing. But that's kind of what that is to me. Have patient close his or her glottis after maximum inspiration, relax the diaphragm, and then just allow the air to shift. And I'm just telling you, I'm not good at that. If you want to try it, it's in your book. It's part of it. Another one is the strengthening exercises. We already talked about putting weights there on the diaphragm area right below the sternum. On the assisted cough, has anyone ever seen a quad cough?
I've done them.
Yeah, it's literally, because they don't have any stomach muscles, you take the palm of your hand, and when they're coughing out, you're gonna push the palm of your hand underneath their ribs, and you sometimes go pretty far up in there. So and it helps them cough all that stuff up. It's very effective. And so if
You don't get right in front of them then when you do that.
No, I've never had one throw up on me, but you
Well,
want them
even if
to
they cough
cough.
stuff out.
Yeah, because they're in an upright position, and you kind of get into a rhythm with it, and you just get good at it. You just have to do it.
The guy that I always did it for was always laying on his side, like I would roll him onto his side while he was in bed and have his head on it just barely raised up a little bit, and then I would do it for him, and he would cough, and then he would spin it onto a pad on the floor, and then I would throw up, but not him.
So yeah, it's just a way to do that, and you epigastric, so it's right above the stomach, but it's pretty much right, underneath.
And Brittany would like to volunteer for that one.
Well, you can't volunteer because you can't have any stomach muscles. So you have to see the person to do it. I'll tell you what, we might be able to find that on YouTube, I'll watch for that, I think they'll have that. The abdominal support is something else that you can put on someone who's dealing with hypotension, again, on the tilt table, but also, I've had high-level quads wear them anytime they're up in their chair. Some of them never do get their blood pressure where it's very good, and those are the ones who don't do very well, by the way, because they never do feel good, they're always feel dizzy and.
Does that also help to support them sitting upright?
Absolutely, yeah, just like our little boy. I mean, that Boston brace absolutely transformed him. Did y'all realize that when he had the brace on, he looked like a different kid than when he was laying there without anything on him? So that brace has given him a lot of good support besides just making the scoliosis be corrected. Some of the things you want to do on the stretching is what happens with the quad is they get really tight here because usually their posture is this, right? This is a very bad exaggeration of it, but so you want to stretch out their pecs, and sometimes this is not normal, but you just want to do a lot of stretching, but especially an old quad that's been in a chair for a long time, you'll see them tighten up there, but you want to stretch them out anyway because it helps them breathe, right? They can expand their lungs. On the range of motion and positioning, you're gonna go ahead and start, and that's mainly what you're gonna start with them. Depending on what their bed status is, they usually stay in bed for 2 weeks because of what? What is that called that they have initially? Spinal shock. So until that doctor can go down and get some kind of reflex reaction with the Babinski, they're probably gonna lay there because their body is healing. So they may already go ahead and have surgery. They do a lot of surgeries on them. They may be fitted for some type of a bracing, like a turtle brace for your paraplegics or some kind. Maybe for your quads, they're gonna be put into a halo brace or a Philadelphia collar, or they're gonna have surgery or whatever. So you're gonna go ahead and start range of motion. What you wanna be sure, check out is make sure it's okay to range the neck, right, with a quad. If they've had surgery, you may not range it till that's healed. You probably won't. That's gonna put them, so you're not gonna do any range with them, even surgically, till that heals, would be my guess. But then, after it heals, you need to get them moving, because what happens with them is sometimes they don't get moving after that because no one's working with them, and then they get really tight. And if you're dealing with a high-level quadriplegic, their neck is part of their driving mechanism. Remember, using the back of their head, so they've got to be able to turn their head.
How would you stretch their pecs? 'Cause I know how you would normally stretch your pecs, but
It'd be the same way. You just stretch back and have them push back against something.
How would they push if they're quads?
They're gonna have, their pecs are there, so you just have them, depending on what level they are.
oh yeah.
Remember, they've got their shoulders are there, right?
Okay.
C5s or even, if your deltoid, C6.
Okay, that makes sense.
Are you guys caught up to speed?
You want me to see?
You do need to watch the shoulder range of motion for anybody over what level? Really C5 and above, right? Because they don't have their whole rotator cuff at C5. So you don't want to dislocate a shoulder, and you can do that. So you have to be very careful with shoulder range of motion with them.
See there? That's why I asked, Brittany.
And then also with your paraplegic, you need to ask how much, if you can even do hip flexion with them. They may not want, if they're just had surgery, just like with your back patients, you don't do stretching with them till how long? How long does it take to heal a bone? 6 weeks. So unless the doctor specifically says get in there earlier, that's a really good. If you're dealing with an old lady, how long?
8 weeks.
8 weeks and probably another x-ray worth, because you want to make sure that that's healed in there. So just be very careful to follow those kind of precautions depending on where the surgery was done or where the fracture was. Selective stretching. Certain muscles we allow to remain tight, and one of those is a tenodesis. When we bring our hands back, then they have a tenodesis. That's what this is called. Everybody knows this is tenodesis. You need to know that term. A tenodesis grip allows a quad to actually have contractures in his fingers so that he can put a spoon there and eat and do things things, maybe even with an assistive device, to keep his wrist up if it's a C, what? 5 or above. So so you encourage tenodesis and you actually will see, if you've seen a C5 quad running around that's been a quad for 5 years, their fingers are here. Yeah, well, no. And, so anyway, they're in the, and so if you'll, of course, y'all don't ever ask questions, but ask them questions when you see them. Tell them what you're doing, and they like to talk about themselves. Don't y'all like to talk about yourselves?
Yeah.
Okay, I mean, they'll tell you if they don't want to. So,
What, okay,
Oh,
I guess, patient that I took care of, I don't know what his limit was. He didn't have any feeling in his shoulder, I could have sworn I remember he showed him a little bit, but he ended up getting a 3rd-degree burn from a hot pack. So I'm gonna say that he didn't have that much, right, but his fingers were not contracted up, they were out, and they were like hyper extended.
that's because he was above a real high level. So that's what you see with the C3s and C2s and C1s.
If they're lower than that, they'll get like a contraction.
They'll have the tenodesis. But when you see those high level quads, their hands are usually like this. They're just.
Well, okay, how low of a high level, I guess, can you be, because he didn't have to be on a ventilator or
He
anything
could
like
have been
that.
a C4 or C3 and not been on a ventilator. Did y'all hear what she said about the burn?
No, I
Tell
couldn't
me
hear
again what
anything.
you said about the
What,
burn.
oh, I just said, what, that he got burned from a hot pack, he got a 3rd-degree burn from a hot pack on his shoulder, because he was a quad, and I guess he didn't have any feeling there.
So how important is it to worry about hot packs with people that have no sensation? Is that therapist liable for this guy?
Oh, it wasn't even a therapist that did it, it was the CNA that worked there, that decided that she would put one on him.
Yeah, well, that's
That was
the
one of the
thing.
things that we.
Some of the CNAs are allowed to get into that stuff,
Mhm.
like the
Well,
hot packs and things.
There, well, you wouldn't be liable if you didn't do it, and you didn't tell her to do it.
Nursing
Prob-
home.
well, that's why people are taking hot packs out,
That's why they
because,
should.
again, they're the highest liability in the physical therapy
Right,
world.
well, they
We just
changed
learned
the
that.
policy there, only, LPNs and RNs were allowed to do them, because they just put hot water on them and stuck them in the microwave and then threw them inside of a plastic bag and, set it on his shoulder, she forgot about it.
Yeah.
3rd-degree burn, think about how hot that thing was, that was a hot pack. So anyway, I'm just telling you that, because remember I told you about the paraplegic that in New Mexico jumped into his car and he had on those parachute pants and he had like 2nd and 3rd-degree burns on his butt and had to lay on his face for 2 months for while it healed. Have I told y'all that story?
No.
Well, if y'all never been, if you've been into the, see, I never remember him. I feel like I tell y'all the same stories over and over again. Anyway, we had a guy, I'm gonna tell y'all how he was hurt. He was a really nice guy from Alamogordo, and he had been to the beach, and they were all drunk, and they were flipping cars over out on this beach area, wherever it was. I don't know where these old
Whoa,
cars
whoa, whoa.
were. And he got
Flipping cars
underneath
over?
the car, and the car caught him like this, to where his head was completely over his legs, and it broke his low back. He was an L3, L4 spinal cord injury. Had lots of
Oh,
pain.
he's like a sandwich.
Yeah, he was sandwiched
No,
underneath
she told
the
us that.
But she told us back in the
car.
city.
What
Not
happened?
that, she told us about him sitting.
Flipping cars.
Flipping
Actual
cars.
cars.
He was flipping cars out on the beach somewhere, and he was sandwiched underneath it accidentally.
What do you wanna do to
When
me?
they were all drunk. And,
Young male and
so
alcohol.
anyway, what had happened is he had gotten the hand controls, and he was still getting rehab at New Mexico Rehab Center, which is Roswell, if y'all have ever been to New Mexico. But in New Mexico, the heat, you know how hot our cars get if you don't have one of those sunscreens in there? Well, in New Mexico, literally, it can burn you. You can put your hands on the steering wheel and it will burn your hands. You will have 2nd and 3rd-degree burns. And so that's what had happened to his seat. And he didn't feel it when he got in there, and those parachute pants were always bad. I'm telling you, I had more weird things with parachute pants. They never were good for anything. But anyway, I also had a student wear them once to clinical.
OMG, Becky. No, they didn't.
It's been, well, how long has it been since those parachute pants were around?
80s?
Yeah, no, forgot that one. I came here in '96.
They're only good for if you're falling
I
out.
was gonna wear them through.
Okay, are you talking like
Let me check my
Yeah, windsuit pants.
Oh, okay.
Red
They were
pants.
called parachute pants, but probably in the '80s, they were called parachute pants.
Mine was made out of red leather.
Well, that might
That
not
wouldn't
hurt
be
your butt if you got into it. But it
That's
wasn't red
why
leather.
it makes a comeback, and
That's
I've
your
seen
80s hair
people
band pants.
They didn't have,
around
they didn't have
wearing
butt cheeks
like
in them though.
big
People on this campus wear pants like that.
Yeah. Anyway, back to those, that's what he sat on. So again, he had no sensation, did not know he'd even done that until he got to Alamogordo, which is about 100 miles from Roswell. So, did not even know. I've seen a quad lose 2 or 3 toes because it got caught in something. Quadriplegics, as diabetics, always need to wear shoes. Don't let if you're really educate them, they need to be wearing shoes. Why? They don't feel their feet. So if they hit their toe on something, they literally can completely lose their toe and not even know it. Trust me, they do not feel it. What happens with a spinal cord injury is they'll go into spasticity and stuff, but they don't feel it. I mean, they'll know something's happening to them, but they won't feel the actual pain from the broken toe or whatever. But you just they need to wear shoes all the time when they're out of bed. Because even at home, they're in their chairs, they run into things, right? So, okay. The other thing that we watch on are the hamstrings for a quadriplegic and for a high-level paraplegic, because you don't want to stretch them so much because with a little tightness in the hamstrings, that helps their sitting balance. So you only want them to about 100, I mean, they can go to normal, 90 to 100 degrees, but you don't want them, 120 to 130 degrees, which they're gonna get because they've lost all that muscle tone. Some of the other things you're gonna do in acute is positioning splints, but hopefully you have some ready-made ones, or you have OTs that will make those for you. Ankle boots, because you want to avoid what? Heel cord tightness. You don't want heel cord tightness with them, so you're gonna put them in their shoes 2 or 3 hours a day and take them out. You're gonna have some kind of heel coverage that's also a boot that keeps them at 90 degrees at the ankle. Selective strengthening, again, you only do strengthening that the doctor allows. And then orientation to the vertical is to get them up. So that's kind of what you're doing in the acute stage. You're getting them ready for rehab. But you want to avoid what? Bed sores, contractures, just any kind of problem. You want to avoid that and start getting them moving and whatever they can do within their limitation because of their surgery.
At Sparks, they had beds that had water and sand in them
Yeah.
that moved. I don't know what they were called, but it was amazing.
I can't think what they're called either right now. But yeah, they're really nice, aren't they?
Yeah.
And that would probably be a good thing for spinal cord patients. Okay, subacute, this is what we're gonna do today in lab, besides the respiratory stuff, is we're gonna start doing rolling. And as we read through this, there are ways to position your quads so that they can start practicing on rolling. You just have them. Any of y'all had any experience with it at all? You have to realize that they're like rag dolls. They look like Nat. What's his name? Nate. They look like Nate they're like that, except they don't have that. Some of them have that spasticity, but most of them don't. So they're starting from nothing. They're absolutely scared to death, right? And they want to die, right? Most of them, yes, when they realize what's happened to them. And so you're going to start them just teaching them how to roll, swinging their arms side to side, getting them up and sitting. But to row, you want to begin in the supine position. Flexion of the head and neck with rotation may be used to assist movement from supine to prone. Extension of the head and neck with rotation may be used to assist moving from prone to supine. We'll practice that. Does that make sense how you can pull? As you're bringing those arms over, you bring the head up, and you're going to cross their ankles, and you're going to set them on a pillow the first time and let them start working where they're strong enough to do that. And they get strong enough to do complete bed mobility, right? Especially C7s and below. But C6s are capable of being completely independent bed mobility. then your bilateral symmetrical upper extremity rocking with outstretched arms produces a pendular motion. Cross of ankles will also facilitate. And then using pillows to help prop the pelvis up to get started. So they're going to start having them just move their arms. And so that's how you start them on the mat. You just start them with rolling. Then once you work on them in supine and rolling, you're going to put them prone on elbows. And you can just, first you just put them in that position and you start having them push up. That's one of their exercises, is to push up. So, and then to go back and weight shift, you can start doing weight shift with them. You can start having them reach just like a baby, quite frankly, that you're wanting them to be able to get strong enough to shift over onto one elbow and to reach out with their other hand. Then you're going to move them up to prone on hands, and then supine on elbows, because you're going to have to get them where they can sit up in the bed by themselves, right? So you're putting on supine, and then you teach them how to get up, and the way you do that is you have your paras and even your quads stick their hands in their pockets or underneath their hips, and they throw their body forward and throw their elbows back behind them. I mean, it's when you first start with them, they'll say, we're never going to be able to do this, but they do get there. You just have to keep working with them. Another thing that you can do with quadriplegics is have them do pull-ups, like grab their hands and just have them start pulling up on you, especially a C5, because you're going to be working their scapular. You have to watch their shoulders though, right? But it's just a good way to stabilize them and get them strong, so that's a good one to do, is just pull-ups. Working with a spinal cord injury is very, very energy consuming. Tremendous. If you do a good job with them, you should be tired. So if you don't do it, if you're not tired after working with one of them and you've had them on the mat, then you're probably not doing a good job. So and I see a lot of bad jobs. I'm just telling you. I've seen a lot of bad therapy. So we don't want to ever be bad therapists. We got to give them 100% because we got to get them up and going. And I know none of them will be that way, but I mean, you just really have to work hard with them. You're going to be lifting them and twisting them and doing all that stuff. In sitting, you're going to work in both long sitting and short sitting in that position. Normally, and it doesn't seem like y'all could do this, but from the very beginning, when I'm transferring a quad onto the mat, I will get a sliding board. I will bring them forward. I'll give them push-up blocks, and I will make them help me get them over there. Even if they can't do it, I put them in the position. I'll lay their head on my shoulder, and I'll have them push and just start pushing themselves over as best they can. It may take 4 of you to do that the first time, but at least 2 of you to protect him or her. But you really go ahead and get them started into that routine to where they have to be helping. You just don't want to lift them up and put them on the mat because they need to get started quickly. Initial activities will be just being able to maintain sitting. And so you're going to just sit them down with their hands down first and work on their balance. You're going to have them take one hand up at a time. Then you're going to, as they get where they can sit and kind of balance, you're going to start throwing a ball at them. There's all kinds of balance activities, and so they're kind of fun to do that with. So you're going to do that in short sitting, and then you're also going to do it in long sitting. They need to be able to maintain up in long sitting. Remember how we talked about doing push-ups? That I'm a big advocate of doing wheelchair push-ups for everybody. You do that with them also, and so you're going to start with just on the side of the mat because you're working their balance, but you can do it in the wheelchair too. But on the side of the mat, you just start with the block and have them start pushing up. And I get behind them so that they can, and literally will lift them the first time so that they can realize they can do it. So sometimes it takes 2 or 3 people to work with them, at least 2 initially when you first start working with them. Unless you're just really strong or they're not real big. It just depends on what you feel like you can do. And then as you get into a long sitting and short sitting too, you start doing a 4-point push-up to where they can lift up and straighten their elbows. Then they lift their hips back using their shoulders, and then they bring their body forward again, and then they go down. So we're going to practice that today. And it's hard, it's a hard thing to do, but they've got to get that kind of strength. So you'll do that in short sitting and long sitting, so that they'll get where they can move themselves around on the bed, long sitting, actually pick themselves up and do, move their hips, but they have to clear their hips, right? Why? Why do they have to clear their hips when they lift?
So they don't get a.
Yeah, they don't wanna shear their bottom and get a bed sore, cause they don't feel it, and then they won't see it. Quadruped position would then be the next position that you get them into. It's just good for everything for them. If you have a kind of a lower level, like a C7 quad, they need to know how to do quadruped to get up on their hands and knees to get out of a house if it's burning, right? So things like that. It's something I always think about. But it's just a good position for them to work in. You can start them on some type of a bolster underneath them, and then have them do push-ups there. There's just all kinds of things you can do with a quadruped. You can have them go side to side with their hips as they get stronger in their upper extremity. You can have them bring their hips side to side. There's just a good place to work them. Kneeling, then you can bring them up to kneeling. And for your paraplegics, you want to do this because it's really good for if you're going to do any kind of gait training with them. They can, most of your paras, if they're L2 injuries, if they go up on their knees, it helps them stabilize their hips, because what muscles are they missing in their hips? An L2 paraplegic. They don't have any glutes, right? Their glutes are gone.
Don't have any quads.
And their quads aren't there, but they have their hip flexors, and they really can learn to stabilize and bring that leg through with that hip flexor, so that you can get them up into where they can walk on their knees. And so you can do some of that on a mat with the L2 and below.
It doesn't even seem like they could get up in quadruped.
They can though. They learn to balance on their legs, and they just have enough, well, they have all their trunk. See, so all their trunk is there down to their pelvis. And so they just learn to balance on their legs, and then they can bring their leg forward with the hip flexor. So they're able to do it. It's not easy the first time, but they can do it.
Okay, so for somebody that was like that, I don't know, not on station, but would it make it easier on them if they had like their legs amputated or something, like so they would be lighter so they can move easier, or do any of them like opt to have that done so they're not in the way or something?
It's never an option. Amputation, although I will tell you, we had a guy here in Poto that was in a really bad car wreck, and his whole arm was, the brachial plexus was completely severed, and the whole arm was just flaccid, and they did amputate his arm, but that's the first time I've ever seen it. He had amputations are not normally something that you do if you have a paralyzed limb. It's better to keep your legs for sitting balance. There's just they just don't do that. It's not something that, I don't know that it would be better. I think health-wise it wouldn't be, but that's the only time I've ever seen it done. And that guy had that arm amputated, and he was having such horrible pain in it. I think maybe it was such severely broken, but he's also completely paralyzed. He lives out at Monroe. Anybody know him? I don't know. I can't remember. But anyway, he's out. It happened the wreck happened probably 6 or 7 years ago, and then that amputation was maybe 3 or 4 years ago. But anyway, it's the only time I'd ever seen it, so it's really not something they normally do, so it must not be good for them. Okay, transfers usually initiated once the patient has attained adequate sitting balance, but as I was telling you, I always go ahead and just put them in that position and hold them up and let them start doing push-ups and getting in and out that way. Remember, with the pressure relief, they need to do 10 to 15 seconds of pressure relief for every 5 to 10 minutes of sitting. C6 and below, they can do the wheelchair push-ups or off the wheels. The C6 does off the wheels. And then a C5, they can assist with it, but they cannot completely clear. So they have to have a tilt in space. A C5 cannot completely clear themselves. So C5 and above have to have an electric chair that would tilt in space, because they also can't push the chair very far. Remember, a C5 can use quad knobs and go
What do you mean
short
by
distance.
tilt in space?
power chairs that tilt like this so that you can have pressure relief. You saw those at Hot Springs.
Okay.
Yeah, that's
We
a
have a guy
tilting
at
chair.
church that has one of
I
those.
thought you
Yeah.
maybe just lifted one cheek up and gave it a little space on that side and then it would come back down.
No,
That would be a
I
good
mean, it
idea.
tilts the whole body and does that. It's just the whole, lays them down and then picks them back up, tilts in space. Ambulation with paraplegics, you have to have full range of motion in the hip flexors, and so that's why doing the, half knee, or the kneeling is a good thing to work on with them. And then it's gonna just get into ambulation with the paraplegics, and I think we'll save that, because we're not gonna have time to get into that today anyway. So that will be good. Take about a 10-minute break, and then we'll go into the lab and do a little bit of